I'm delighted to be here today and to discuss about the article that will be appearing in the upcoming issue of the Mayo Clinic Proceedings. So in this very broad, comprehensive review of the literature entitled Obesity and Heart Failure, Focus on the Obesity Paradox, that I wrote together with Dr. Chip Lavie from the John Ochsner Heart and Vascular Institute and Dr. Ross Arena, which is a professor of physical therapy at the University of Illinois in Chicago. We wanted to emphasize the role of and describe more in details the role of obesity in heart failure. There is in fact a controversial role of obesity in heart failure. On the one hand, obesity seems to be a risk factor, an independent risk factor for the development of heart failure. On the other hand, when patients has obesity and heart failure at the same time concomitantly, obesity seems to exert some protective effects. And more specifically, we looked at the importance of the role of body composition in the development of heart failure, and how body composition compartments, more specifically fat mass, fat-free mass, and lean mass, might actually play a protective role once heart failure is diagnosed. In a brief summary, what we found is that the lean mass seems to be really important to play a major role in both the development but also in the potential protective role of obesity in heart failure. More specifically, there are some hemodynamic and structural changes of the heart of our patients. They might be due to obesity and specifically to increased amount of lean mass. But also some negative effects of other negative effects of adipose tissue that is able to produce a certain amount of pro-inflammatory cytokines, also named adipokines, with direct cardiodepressant properties. In reality, the World Health Organization defines obesity as an excess body fat that impairs health. I think it's really important to highlight the importance of assessing body composition to determine if there is an excess of body fat. Once heart failure is actually diagnosed, lean mass might exert protective effects. And how is that even possible? We think that lean mass is a major determinant of cardiorespiratory fitness in patients with heart failure, and cardiorespiratory fitness is an important predictor of mortality in this population. And the higher amount of lean mass is being associated with better cardiorespiratory fitness, so the idea is that the higher is the amount of lean mass, the better will be their cardiorespiratory fitness. What we believe and we advocate for is for an assessment of body composition in our patients, not just to determine the amount of fat mass the patient have to determine whether they're obese or not, but to determine whether they also have a reduced amount of lean mass. And if there is a reduced amount of lean mass, these patients will be classified as sarcopenic, whether if they have a reduced amount of lean mass in association with an excess body fat. At that point, we will be talking about a condition called sarcopenic obesity, which has been associated with worse outcomes in a number of chronic disease and recently also in heart failure. We then discuss the role of diet in the development and progression of heart failure. We think that if you eat a healthier diet with a lower amount of sugar and saturated fat, they might be having some beneficial effects by reducing the amount of systemic low-grade inflammation. Our body, when we measure our body weight, we only have a rough estimate of the quality of our weight. To really determine whether somebody is obese or is not obese, we really need to measure body composition. If you have an athlete, especially if, like for instance, rugby players, their BMI might be 35, 40. We had sometimes we had an athletes in the past that had BMI higher than 45. They would classify them as a very obese, severely obese. In reality, you go to measure the body composition, and their amount of lean mass or muscle mass is so high that you would never define them as obese subjects. That's why the body composition assessment it becomes extremely important. On the other hand, you might have a subject with a BMI of 23, which might be considered a normal body weight for in relation to their height, but some patients might not be very fit, and so they might have a lot of fat mass compared to the lean mass, and in that case, they would be still considered not a very good body composition status. Well, the takeaway message, I think, is that the treatment of heart failure, it cannot just be one. And we think that the assessment of body composition for a better nutritional status certification is essential, as well as some non-pharmacologic therapies such as exercise training and more specifically resistance training, to trying to increase the lean mass and the muscular mass in our patients, as well as a low saturated fat and low sugar diet. And to do so, I think that the multidisciplinary approach plays a major role, in which physicians, nutritionists, exercise physiologists, and pharmacists, they have to work together. Because one of them, it's not enough.
We hope you found this presentation from the content of Mayo Clinic Proceedings valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.